Today, I'm going to bring you a discussion that I had with a man called Dr. Fred Moss. This guy is fascinating. He is a clinician who has gone the route of finding connection with clients over medicating them. I don't know what you think about this practice or this idea, but Fred is a clinician who knows what he's talking about. It's a fascinating discussion. I'm going to do this in 2 edits. I'm going to bring you the full interview because I want you to hear from start to finish, but I'm also going to do a highly edited version. So, let's just dive in and see what happens. Welcome to Mark My Words. Mark My Words is the story of my journey from a place where I was shattered to where I could live again. Well, it is my absolute joy today. We have been trying to hook up this interview for a couple of weeks and I've finally got him. Dr. Fred, g'day and welcome to Mark My Words, mate.
Yeah, it's really great to be here. Thanks for having me. I'm really, really looking forward to today's conversation. I really appreciate who you've been in pursuing me, and I'm so glad that we were finally able to catch up.
Now, mate, your CV is extensive.
It is.
I'm looking at it myself here. I would rather just ask you, who are you, Dr. Fred?
That's a great question. And that's the number one question I use in my podcast as well. So I don't often get posed that question that I ask other people, and I watch other people kind of squirm around that question as if it's a difficult question. And it really is the easiest question to answer in the whole world, right? I mean, what the hell? What am I doing? What is this thing called me? And so, we could start back in the day. My name is Fred Moss. My name is often known as Dr. Fred, and a lot of people just call me Fred. And, I was born into a Moss family, a family that had 2 parents and 2 brothers. And my brothers were 10 and 14 years older than me. And, I was born into a family that was in a fair amount of chaos and disarray, as you can expect from any family with that particular configuration. And I was called on to bring joy and love and some form of unity to a family in that level of chaos. And apparently I did a pretty good job coming out of the gates. I don't think that I've done a great job for the entire 66 years I've been alive, but for at least a couple of years, I was probably pretty good at bringing joy to them. And as a bundle of joy and as a source of smile and a source of love and a source of togetherness, I learned a lot in those first several years. And I learned how to be human. I learned how to communicate. I learned how to manipulate for my ways. I learned how to listen. I learned that different people had different ideas. And what I wanted to learn more than anything was learn how to communicate. I watched these 4 people talk to each other and I wanted to be like them. I knew that someday they told me that I would be a big boy and that I would actually learn how to communicate. But up until that point, it was just a matter of being in my playpen in the middle of the living room and watching them communicate and hope that someday, maybe, I would learn how to communicate. Well, my little sister was born and I became her source of communication. She had a little bit of a lisp and I was the only one who understood her. So I would tell people what she said and I became even a translator. And then I went to school and I expected, what's school going to be? Well, school's going to be where I learned how to be with people. I learned how to communicate. Well, I already knew too much. You see, my family made me precocious. I knew how to do math. I knew how to read. I knew how to write. I knew a little bit about sex, drugs, and rock and roll. I knew a little bit about humanity already. But the thing I learned that it was kind of surprising was that school isn't a place where you learn how to communicate. In fact, if you try to communicate while you're in class, the teacher tells you to be quiet and sit down. What I learned is that what school is demanding of me is to be quiet, sit down, do what the teacher does, and do what she says or he says, and do it just like them. And that way I get to pass into the next level. It's very disturbing and very confusing. And I figured, okay, well, someday I'm going to learn how to communicate. That must be in the higher grades. So I assumed that was going to happen maybe in junior high. But throughout elementary school, I talked a lot. There's no teacher who would ever forget having Fred as a student in elementary school. I talked a lot. I was, just attempting to communicate. What else is there to do? And in junior high, I learned how to be even quieter, that they had bigger, mightier forces that kept me quiet. And then in high school, it was even worse. It was like, no, really, sit down and be quiet. And I still learned things in high school, but almost everything I learned was outside of the classroom. I eventually learned that that's where I was going to learn how to communicate, was outside of the classroom. And I decided that I would go to college anyways, and maybe there I would learn how to communicate. I went to the University of Michigan. I started there and I went for about a year and a half. And then I dropped out because why? Because it wasn't teaching me how to communicate. And it just wasn't going to work for me to have to sit in these hard chairs during really wonderful days and try to listen to somebody and regurgitate what they said. So, I became a real proponent for learning how to communicate. I dropped out of school and came out to Berkeley, California to find myself. And indeed, I found myself. I took a bus, it's like just like what you did back then. And I found myself, but it wasn't sustainable. My family convinced me to come back, and there was this new industry opening up at the time, and they thought I would probably be pretty good at it, given all my all the things all the things that I could do, given all my skill set. And that new industry was called computers. Maybe you've heard of it. The only computer in all of Michigan was at the University of Michigan. It was a 2-acre facility, and boom, I'm back at the University of Michigan doing computers. It's like, look, I'm not going to do batch jobs and punch cards the rest of my life. I'm not going to sit up all hours of the night turning in big stacks of punch cards. So that only lasted for less than a year, and then I dropped out again. It's like, I'm not doing school ever again. I told my family, never. I'm not going back. My mom's like, well, you got to get a job. Mom, moms will be that way, right? And so I got a job as a child care worker at a state mental health facility for adolescent boys. She had got me the application. I was glad to start the job because they were paying me enough money that I could, work for like 3 weeks in orientation before I even got to the floors and take those 3 paychecks and buy myself a car and drive around the country and learn what I'm about. That's what I was like, I'm not going to go work with kids. And sure enough, on the 4th week, someone convinced me to stay, and I went up to the floors. And that's where I finally learned that communication. And tears come to my eyes when I talk about this, because that was really an important phase of this life. That decision to come back on the 4th week, I've done a lot of podcasts and spoke to that, and I don't remember feeling this emotional about it. It's like really realizing, that was a major turning point. When I decided to go to those floors and decided that I could actually be somebody on those floors, and then learn that I could actually talk to these kids, actually be with these kids, 6 years younger than me. They're not very much younger than me. And all they were humans, just going through life just like me. That's all that they were. They found themselves living where they were living, and I was living where I was living, and we weren't that different otherwise. And I could really communicate with somebody, resonate with somebody at a high frequency, and in that process, create healing. In the process of seeing them for who they are and who they're not, I could create healing. And in that process, not only they would heal, I would heal just by connecting with them. Even if they had a mental illness, a so-called mental, even if they were sure there was something wrong with them, that didn't bother me at all. I didn't care what other people said about them. I cared that they were human. And healing would take place, and would take place across the board. Well, I became a real proponent now of communication as a source of healing. I mean, it's what I wanted to do my whole life. And that's you'll hear that, of course, that's how it all develops. That's how I get to be who I am now. So I eventually reached the point where I just hated psychiatry inside of that job. I couldn't stand psychiatry because psychiatry was shifting away from communication. It was starting to, if kids were trouble, we would call the psychiatrist. He'd come down, he'd interview me for like 5 seconds, interview the kids for like another 5 seconds, and go in the nursing station and write some notes. And then we'd have to go retrieve the child and hold him down in the quiet room, pull down his little sweatpants to his hip, jam him full of some injectable antipsychotic cocktail. And if he stayed stuporous for like a full day, we'd call that a success story. Dude, that's still happening every single day at every single hospital in Australia and the United States today. So don't fool yourself that was like back in the day. That's still happening. This chemical restraint nonsense is happening all over the hospitals everywhere in the Western world. I couldn't handle it. I felt it was just barbaric. I thought it was stupid. I thought it was wrong, and I thought it was mean, and I thought it was just, abusive. But communication isn't abusive. And so I decided that I would go back in one more time to complete my schooling and finish my undergraduate, finish my medical school, get my residency, finish my fellowship, and be a child and adolescent psychiatry that promotes communication. And that's what I did. That's what I did over the next several years, fairly focused. When I came out, psychiatry had shifted again. There had been a massive paradigm shift. And now psychiatrists had become almost strictly diagnosticians and psychopharmacologists. Like that was what we were called on to do. If I was to ask you now, what's the difference between psychiatry and every other field in mental health, you'd probably give me the same answer everybody does, which is that psychiatrists can prescribe medicine. I said, I didn't want to do that. That isn't what I came here to do. And I really saw that they were being abusive at times or really inappropriate with their use of medication. And plus, I don't think that medications really work, which I'll explain in just a moment. Nevertheless, for the first 10 or 15 years of my career, that's what I was called on to do. I saw thousands of patients, diagnose them, give them a condition, create a treatment plan, includes medication, give them their medicine, continue to assess them monthly or weekly or daily or whatever it was, and make sometimes actually not even tell the real truth that whether or not they got better. That's what's called on in the field of psychiatry. And they often didn't get better. And I would say that they were okay. Not getting better is okay in psychiatry. If you stay the same, that's considered okay or a success. If you stay the same level of sickness and you don't get worse, or you get worse a little slower than what we expected, that's called a success. That didn't work for me either. So for a long time, there was a lot of soul sacrifice and heartache involved in being a psychiatrist. In 2006, I made a big shift. I decided to do something that seemed very wild to some of my friends and colleagues, but it was important to me. And I took some of my lower risk patients off of medicine. I started taking people off of medicine entirely. Like, look, it's not making you that much better. Let's see what happens. And when I took people off medicine, they got better, sometimes way better, but almost all the time, almost unanimously, reliably better, and often lost their diagnosis altogether. So I came to the conclusion that these medicines and these diagnoses were actually frequently causing the symptoms they were marketed to treat. So that once you get a diagnosis, you actually grow into that diagnosis. Once you grow into that diagnosis and start taking medicines, and the medicines start causing the symptoms they're marketed to treat, we got a problem. We got a problem, Houston, a huge problem. And here's the problem. It's a great business model. It's a fantastic business model because it gets a sense initially that it's helping, and then it starts actually perpetuating the symptoms as it's marketed to treat. And it creates an industry of people who absolutely need it. And in that process, maybe are getting worse by actually utilizing the system. Of course, I had these ideas that I needed to tell everybody that these diagnoses and medications weren't working and weren't working as well as they hoped. They're just not doing that which they prescribed themselves to do. And I want, but being violent about things doesn't get the point across. So I had a wish to be violent, but it wasn't really working to shake people up or to scream it from a mountaintop. So instead, I learned how to really talk through it, learned how to mellow out about it, be able to present it in a way, hopefully like I'm doing today, in a way that is actually manageable. You can listen, people can hear. And the possibility is that these medicines actually cause more damage than good. Now, here's time for the disclaimer that's really important. You have a lot of listeners here, and some listeners are pretty sure that they have the right diagnosis, that they're mentally ill, that they are being treated properly, they have a great therapist, and they love their medicines, and everything couldn't be better than it is. It's absolutely premier. For those people, I'm not here to argue with that. Like, if you found that in any area of life at all, you need to keep doing that. I don't care what you're pursuing. If you reach that point in any single pathway anywhere in life where you're so certain that this is as good as it's going to get, you need to keep doing that. And I'm not here to argue you. For sure, you should do that. This conversation isn't for them. This conversation is for the tens, if not hundreds of millions of people worldwide who know that what I'm saying makes sense. And there are hundreds of millions of people out there who know that what I'm saying makes sense. This is that conversation. And coming from someone from within the field, there's a fair amount of credibility that I come with. After all, I've had 30 or 40,000 people call me their doctor for at least a moment in their life. And I've worked all over the United States. Shortly after doing what I said, started traveling around the country as a traveling doctor and seeing how psychiatry was delivered in multiple different states. And then I took my act around the world, and I started doing it from Asia and Bhutan and Nepal and Thailand, and also in Israel and England and France and Italy. I was a telepsychiatrist, and I'm doing work and talking to shaman and doctors in other countries. Like, what is this mental illness? What is it to be universally human? What are we really looking at here? And I come up with some ideas of like what we're really looking at, and the whole idea of what is the sham, if you will, of what mental illness is. What are the things that people are certain that there's something wrong with them or they're broken? What is that? What is that? What is the process of thinking and knowing that you're broken? Why does that even help anyone? These were great questions. I asked it for many years, and I asked it of many experts and many patients and many clients and many residents and many colleagues. And I've learned a lot in asking that question and open and honestly asking that question. Now we fast forward a little bit and we get to where how am I going to ever be a psychiatrist if I can't even believe 1 ounce of what the field is about? What can I do to actually make a difference in this field? And the way I do that is by connecting with people. Human connection is at the heart of all healing. You can see that in both my books over my shoulder, Find Your True Voice and Creative 8, Healing Through Creativity and Self-Expression, point towards how we can connect with each other. Because what we want more than anything in my look around the world, what does 7.8 billion people, what makes an Australian very similar to a Sacramentoian or a Wichitayan, like what is really here, is that each and every one of us is completely interested in connecting to another human being. And when we really get that connection is at the heart of all healing, that becomes something really interesting. And when we get that life is hard, let's look back a little bit. We look at Moses, we look at Krishna, we look at Buddha, you look at Jesus, you look at anyone in the history of time. There's nobody who ever said life isn't hard. They've been talking about life being hard since the dawn of time. Adam and Eve know life wasn't that easy. It wasn't easy being Adam or Eve. It wasn't. It wasn't that easy being Abel. It wasn't that easy being Cain. It wasn't that easy being anyone, ever. Life is hard. And it's okay to be anxious. It's okay to be depressed. It's okay to be nervous. It's okay to be afraid. It's okay to be scattered. It's okay to be aimless. It's okay to be awkward in social settings. It's okay not to know what to say. It's okay. It's all okay. Part of the process of being human is dealing with all the trials and tribulations, challenges and obstacles and hurdles that it means to be human. When we can get that it's okay to be uncomfortable, it's really okay. And maybe there's nothing wrong with you. Maybe being uncomfortable is part of the human experience. And you can choose different mindsets and different exercises and practices to decrease your comfort somewhat or not. You could choose not to do that. You could say, I can't. You could say, I can't get out of bed. I can't exercise. I can't eat good food. I can't pray. I can't meditate. I can't take nature walks. Of course you could. I get it that you think you can't, but of course you could. I mean, of course it's possible. But when you get to the point where you're saying I can't, and then people believe that you can't, and you believe that you can't, now you're stuck in a hole for sure. And you can then call yourself broken, sick, and ill and defective if you want. It's funny, psychiatry is the only field that I know of in all of medicine, in all of the Western world, that when you come to get assessed, if the doctor says that you're okay, you get pissed. What are you talking about? I told you you're fine, and you tell me you're pissed? Like if a cardiologist tells you you're fine, you're like, good. An oncologist tells you there's no findings, you're like, that's awesome. When a psychiatrist tells you you're fine, you're like, dude, I'm going to go to a real doctor who knows what's wrong with me. Because people are fully committed to knowing that there's something wrong with them. It's like a universal symptom that we all know there's something wrong with us.
My
it's
daughter
so
did
universal that it's part of the standard of being a human. And so who have I really become? I become a proponent for welcome to humanity, a proponent for a true voice, a proponent for creativity, for meditation, for gratitude, for being and understanding the greater notion of what it means to be human, and acknowledging that maybe even though you feel stuck and you feel like there's something wrong with you, there might be nothing wrong with you. And as the undoctor, which is one of my, I guess, affectionate monikers that one of my friends gave me, we talk about undiagnosing, unmedicating, and then undoctrinating people, because the real access, what the medicines aren't causing the problem. It's the people who are taking them that are causing the problem. You're willing to believe somebody who says eat medicine, and then you eat it, and then it makes you worse, and then you blame the medicine. It's like, dude, it's not that. Medicines aren't even alive. They're just things. If you eat rat poison, you're going to get sick. You know that. Don't do that. Okay. If medicines are making you sicker, then stop eating them. So we start really looking at the trauma of what a diagnosis is, and the trauma of what a treatment plan is, and the trauma of the confirmation that there's something wrong with you, that then has you believe that there is something wrong with you. And when you do that, you are compelled to fix yourself. And when you fix yourself, you start taking medicines that are like Band-Aids with razor blades embedded in them. And you get worse as a process, and thinking that you should be getting better, but you're blaming your condition rather than the treatment, and off we go. That's really who I've become as a clinician. I got other things going on. I'm a cat owner. I'm a husband. I'm a father. I'm a writer, a keynote speaker. I have had a pretty splendid, blessed life, and I'm not going to lie. And I'm also someone who has a spiritual connection, and I'm out to making a difference with my friends and family, and, really trying to just be honest with myself.
You mentioned your book behind you, the Finding Your True Voice. Yeah. I was thinking you were talking about the fourth week of your working in that institution when you were young. And I remember when I was in that situation. I was in an institution. I was covered in pepper spray. I was out of my mind because I'd overdosed. And I was lying in that ward thinking that I could never become anything more than what I was in that point.
Exactly.
And something that on your website that really spoke to me is that you say that each and every person will know that their voice
can be heard, and that who they are and what they do matters. That's exactly right.
How do we help people come from that place where, as you've said, we seem to desperately want to have a label that we're broken? My daughter said to her psychiatrist while I was sitting there, she said, I think I have, I'm autistic. And the doctor laughed at her. And she got really upset at that. And I had to talk to her later on about it's a good thing that you don't have autism.
Yeah.
So we seem to be pathologically inclined to try to find a diagnosis, to tell everybody in the world that we're broken. How do we change our mindset in that to say, basically, you know where I'm going with this?
Oh yeah, for sure, absolutely. I love where you're going, and I appreciate that you even warned me beforehand in our context that it might go in this direction. So thank you for that. No problem at all. I appreciate this question deeply. It is 100% what I'm about. How do we do that? We do that in our listening. Whoever got you to be wherever you are now. Let's face it, you are not a nobody any longer. You are making a difference. You're making a difference all over your country. You're making a difference all over your listenership. You're making a difference with me. You're making a difference with your daughter. You're making a difference with lots of different people, because somewhere along the line, someone listened to you in a way that was powerful. Someone heard who you might be as a human. Someone, and you might even be able to point to that one person who really made a difference. Whether it was a childcare worker in that facility, whether it was a friend, an uncle, a father, a sister, a mother, whatever it was, somebody stepped in and actually saw you for bigger than you had seen yourself. The possibility existed that you were not simply that pepper spray addict who was causing all sorts of damage everywhere. There was all sorts of possibilities available that only became available when people started listening to for the humanity that you are. So what's really here is we start listening carefully for the people that we're with. So communication is a two-way street. I'm pretty good. I'm pretty articulate. I get that. They taught me how to talk before school. I already told you, my elementary school teachers knew that I knew how to talk. Everybody knows I know how to talk. But that isn't the skill set that gets us done. The skill set that gets us done is listening. And what really happens is we start listening to those people who are sure that they're damaged in such a way as understanding why would they want to feel damaged? Like, what about your daughter has her wanting to think that she's autistic? Like, why would that be even something that she's interested in? And if you can get into her shoes, her look, and get, if you were her, you'd want to be autistic too, because if you were her, you would get that you would do everything she'd be doing. So what happened to have her think that? It has nothing to do with you as a parent. It has to do with when we can declare whatever alphabet soup of a diagnosis that we've been given is the cause of the actions that we're having that are difficult to explain otherwise, then we actually get to relinquish responsibility for that part of our life and give it to our diagnosis. So if I can say I'm on the spectrum, or if I can say I have narcissism, or if I can say I have bipolar disorder or ADHD, or if I have social anxiety, or I have major depression, or I have schizophrenia or schizoaffective disorder, if I can say I have a condition, and no worries, this thing I just did to you wasn't really me, it was my condition acting up. I get to relinquish responsibility for the things in my life, for the clumsiness and bumbling and tumbling and complete confusion that I have in being human. Being human is difficult. You don't know what you're doing any more than I know what I'm doing. I can be sure that you don't know very much about what you're doing minute by minute, and neither do I, and neither does anybody. There's a group of people out there who think that you should know what you're doing. That, there you are, you're in a position of power, you should know what you're doing, and there you go. Well, it isn't how it really works. How it really works is that there is no recipe book on how to be human, and very difficult issues arise either within or without us. So they do that, or he says that, or she does that, or I feel this, or I think that, or they don't do that, or I have a physical sensation there, or I have a thought process there. Okay. Welcome to humanity.
So, Dr. Fred, there's going to be people that are listening to us today. They're going to go, okay, well, Mark, you've got this podcast, you've got this, you've got that. Dr. Fred's done this, he's done that. Why is their story important? Why is the person listening to us today, why is it important that they have a true voice as well?
Okay. All right. Listen, it was Henry David, great question. So Henry David Thoreau, he had a quote that he's a pretty brilliant dude. Do some Thoreau reading when you have some time. You're gonna find a guy who knows what it was like to be human. This guy who really, really had a handle on this stuff. He had a handle on the fact that he didn't have a handle. That's what he had a handle on. The mass of men go through life in quiet desperation and then go to their graves with their songs still in them. Is there anything more tragic that's ever been stated by anybody? That you can actually live a full life and never have anybody know who you really are? Extraordinary. Us humans were taught how to pretend to be someone that we're not in order to protect the person that we are. When were we taught that? I wasn't taught it I was sort of taught it when I was in my playpen. I think my brothers probably told me to shut up a few times when I was in my playpen. But I really got to tell you that in the conventional school setting, in the conventional education setting, I was told that a lot. Like, stop being Fred. Stop asking those questions. Stop troublemaking. Stop reaching out and talking when you think it's okay to talk. And I was taught how to be someone that I really wasn't in order to protect the person that I am. Now, the crack in the cement has gotten larger over time such that we become really an ingenuine species, an ingenuine species. In some cases, lying so much that we even say things that we don't believe. Some people actually say things as if they believe them, and they know they don't believe them. That is so absurd. That is such a ludicrous, preposterous strategy to get through life. I'll tell you what happens when you start listening to that person that you think had, this person like who's listening to us wondering, who cares about my true voice? I care. I care because that's where healing happens. I care. I want to talk to you. I want to answer. I don't even want to talk to you. I want to listen to you. I want to be with you. I want to resonate with you because I've had the opportunity over time. I've worked in every single modality that Western medicine has to offer for psychiatry: inpatient, outpatient, orphanages, nursing homes, homeless shelters, three-quarter houses, halfway houses, Suboxone clinics, methadone clinics, partial hospital programs, jails, prison. Here's what I got to say about that. When I connect with people in some of these facilities, when I actually connect, sometimes I'm the first person who has connected with them, maybe even for their whole life, but sometimes for decades. When that happens, kaboom, dude. Like, it is so cool. It is so cool to resonate frequency-wise, harmonically with another human and get that there's a real soul over there. And when that happens, instantaneous healing. You don't need to wait 3 weeks for your blood levels to get to a certain point. You don't need to wait 6 weeks and deal with side effects in the meantime. You need to connect with another person. And the more authentic you can be in that connection and creating that harmonic resonance, like a tuning fork. Why are we like tuning forks? All 7.8 people walking the face of the earth have a certain thing in common. You know what it is? They're human. All 7.8 billion of us share that aspect. We are human, and therefore the capacity to harmonically resonate with another one of us is truly available. I am here to tell you that I don't know a more powerful instant in life than the possibility of connecting with another person. When that happens, that's where love takes place. That's where healing takes place. That's where the energy of humanity is centered. Why would we ever even approach God? Why would any of us ever take plant medicine or LSD or even smoke weed or even drink? Why do we do any of that stuff? Somehow it makes it easier or more available for us to seem like we're connecting with other humans. Because that's what why are you and I talking, 10,000 miles from each other? So we can connect. The hope is that you and I will be able to connect and we'll be able to actually be a model for others, and that in our connection, people will get something by listening to us connecting. That's where the action is. So what are we really saying to those people who have found themselves hiding or afraid? I'm no wrong making here. It's a scary world out there. We're scared to present our real self because we're scared we're going to disrupt or be disrespected or be dismissed or be displaced, thrown off the island, or that we're going to be misunderstood. And therefore we choose not to say what it is that's important to us. Or we even, like I've already said in the more extreme case, actually say stuff that we don't even believe. How can that work? The only way, look, even those people right here who are listening, who really haven't spoken their true voice because they're pretty sure no one wants to hear them, I promise you they're hearing me right now and they're thinking, wow, maybe that dude really wants to hear me. I would love that. What people want more than anything is to be heard, even if they think it's not possible.
You said something really interesting, and it kind of struck me. And it's a thought that hasn't really hit me emotionally. It was that night when I'd overdosed and I was in the psych ward. There was two instances where that really shine out to me. One was in the morning when I went into the ward. I didn't know what was happening. I was still out of my mind. I didn't have my clothes because they took my clothes away. And a nurse handed me a toothpaste and a tube of a toothbrush. Her handing that to me, you said something really interesting about you don't have to wait those 3 weeks to get levels, to get your blood things right, to find that connection. And there's a real beauty in what that woman did. And I really remember her just, it was so normal and so natural. And the other was I was lying on the gurney and my whole body was covered in pepper spray and it started to burn. I didn't realize that it burnt your skin. And one of the cops actually grabbed a wet towel and started wiping me down. I never, ever forget that. That's always, I go into police academies and I tell that story about how a police person can make such a massive difference just by an inch of kindness. I'm so blown away by just that thing of it was just that connection. There was no therapy involved. There was no. I want to. There's going to be people that are feeling a bit of hope at the moment. They're thinking, oh, maybe somebody wants to hear my story. Is anybody too broken? Is anybody too far gone that they would never be able to find their true voice?
I haven't interviewed all 7.8 billion of it. So answering the question if anybody's too far broken to hear their true voice is not something that I feel entirely equipped to answer. I don't know if there's exceptions.
Well, anybody in your experience of the thousands of people that you've worked with?
There isn't. I don't think so. Now, there are some risks. There are some definite risks. So, I have some stories like in the prisons. A couple stories that shine out really seriously about me actually getting someone and it causing more damage than good at the time. It's sort of like feeding steak to somebody who's, eating only tacos or something, like too much of a good thing. Like, wow, someone can actually hear me. And that caused some violence because they had to go back to the real world and back to eating the dirt that they were eating and having people not get them, such that my presence at being a bright light of sunshine in getting them was seen as such a rare, scarce occurrence that they could see that their world was not going to include that and create a violent conflict interface. Okay, that can happen. So I think there's risk in when you give somebody something that they didn't know that they could have. There has to be some continuity available. So they have to be able to accept that. You have to kind of modulate it enough so that you're not overdosing someone with a whole smorgasbord of steak when they've never had anything more than gruel to eat. So that's important. So it's a modulating thing. And, you can make a case that person then showed that they were sick when they became violent. No, that isn't what happened at all. All that happened is that they got too much of a good thing. And in that too much of a good thing, they started to see that now I got to go back to the effing prison and be mistreated every single day by people who no longer know me. And I got a taste of something that was too good. So I think there's that phenomena that at least pay attention to. Is there anybody out there who's so broken that they can't be gotten? I am not willing to accept that answer as yes. Let's put it that way. I'm coming after every single person as if they can be heard, as if they matter, as if that's my impossible promise. By 2030, each and every person will know that their voice can be heard and that who they are and what they do matters is my promise. I live by that. So I don't have time to write somebody off. Here's another place where this becomes very, very, very interesting, especially in our present world. Let's talk about some contemporary issues. Have you noticed there's some divisive issues on the planet at this very time?
No, I thought everything was doing great.
No, there's occasionally there's a divisive issue that shows up. There's things that people believe that someone else believes the exact opposite. There's adversarial positions that are, diametrically opposed to particular positions. Like I believe something and there are people who believe the exact opposite of what I believe. Exactly. And they're vehement about it. Like they're radical about it. They're militant about it. Like they're really serious that they know what they know and what they think they know is 100% against what I think I know about whatever particular issue is. People in our present day and age often disregard that person as a person. We write them off and are no longer interested in listening to them as a human being because they think whatever they think about that particular issue. So like my cat here, that's Winston. We'll see if we can wash him out. But Winston's got plenty to say, and we should include him in this tape because Winston knows when I'm talking business, and that's what he's doing over there. Valentino sometimes does it here. We got 3 cats here. They know how to talk, and that's Winston actually talking about me talking. So if you can include him in, and just if you want to even give him, he's got a website too, you can talk about that. Anyways, when we start really disregarding other people and disrespecting people because what they say is diametrically opposed to what we thought we knew, we cause damage there. So when we decide that that person is no longer worth listening to, we cause damage. When we get to the point that we think we're righteous enough to think that that person who thinks that about that no longer deserves to be listened to for being a human, we cause damage. I'm not exempt from that, by the way. I'm not above that. I'm human. I get it. I get how we get there. Nevertheless, my intention is to create a space where disagreement is welcome, but disrespect is prohibited. Have you ever noticed that person who's diametrically opposed to you on that particular divisive, sensitive, divisive issue, if they're speaking from their honest, authentic truth, you can actually hang with them. Even if they're full of it, even if you're positive that what they have to say is so dead wrong, if they're speaking from an authentic core value that is truly, genuinely representing who they know themselves to be as a human, then you can actually hang with them. So that authenticity is what's critical here. The fact that that person is diametrically opposed isn't the issue. It's the fact that you might write them off for their inauthenticity. But when we can be authentic with another person, we can actually share their authenticity as well, even if they're in full disagreement. So I like to say that authenticity trumps agreement 100% of the time. And excuse me for putting a divisive issue in between those two words.
Mate, this conversation today has been amazing. I could quite honestly speak to you all day. I want to give you an opportunity. You mentioned the 2 books behind you. Where can people get a hold of those? I think that's important that we give people that information.
Yeah, so both books are available, and that's 2 of the things that I've done. I've also done a couple courses, and I'll be glad to show you how to find that book. Both books are available on my website called Dr. Fred 360, drfred360.com, as well as my main website, which has been around for about 6 years, and it's kind of like a more broad website, and that's the welcometohumanity.net website. And both the books are available. You can get them on PDFs, or you can actually have them. You can get the Creative Aid on Amazon, and you can get the Find Your True Voice book for free, but just the cost of shipping and handling by going to findyourtruevoicebook.com. And there's that. And I think if you really, what I'm looking to do these days is set up a community. And the community is going to be set up in, Alex Hormozi's school program. And in that school setting, we're going to set up a community of like-minded individuals. These are people who think that there's something wrong with them, or people who think that they're stuck for good. And also the therapists and the coaches who deal with these people. So creating a community where this group of people can meet, where that cop and that nurse and that doctor and that client and that patient and that parent and that person, that that victim, if you will, or that medicated person or that person who's diagnosed can all meet and have a place where, in fact, open discussion and discourse, open communication, the way it's meant to be, is what is called on, where disagreement is welcome and disrespect is prohibited. A safe place to share, a safe place to meditate every single morning, a safe place to get that, in fact, we're living a life as humanity that is so challenging, more challenging than it's ever been. Again, we go back to some of our sages, go back to Moses, go back to Krishna, go back to Buddha, go back to, Jesus. And you talked about, these people, dude, they lived hard lives. They lived honest to goodness hard lives. And we start looking at, well, what worked for them would probably work for us. So what happens when we go out in nature? What happens when we get creative? What happens when we help other people? What happens when we monitor our sleep? What happens when we monitor and take care of our nutrition and our water intake? What happens when we show gratitude? What happens when, we take care of our pets? What happens when, we actually dance? Or there's a whole list called the Moss Method, which I've developed, But I didn't create any of these things. I just gathered them. And they're just non-intrusive ways to find yourself to mental health, find yourself towards mental health in a truly crazy, highly hurt, like highly obstacleized, high hurdles, high challenges world. Now I'm going to quote another superstar, a guy named Krishnamurti, who says, "It is no sign of mental health to be well adjusted to a profoundly sick society." That's what we got going on here. We got a profoundly sick society. Nothing we can do about that. Being well adjusted to that society is not the sign of mental health. It's okay to be non-adjusted to a society that is asking you to do things that are outside of your range of integrity. It's okay to be really uncomfortable with the demands of the present day. And once we get that and get that each and every one of us is experiencing some form of that, and that we can resonate harmonically with each other and connect with each other in that spark of communication, which then causes healing and love to actually like burst. Welcome to Humanity. That's what we're really doing here. And that's where welcome to humanity.net points. That's where the whole Moss method points. That's where the True Voice technology points. That's where Creative 8 points. That's where all of this really ends up going. That's where Dr. Fred really does his work. And that's what I'm a stand for. But you know when I learned this? In the flippin' playpen. It's the same stuff I knew then. I'm not saying anything I learned in medical school. Yes, I've had 30 or 40,000 patients call me their doc. This isn't where I learned it. I learned it back then and have relearned it over and over again such that it makes sense to people now.
So we've got some people that are going to be listening and are going to think, well, Dr. Fred, you've said so much today that resonates with me. What would your advice be for them? Somebody that's listened to this conversation and has said, there is so much that resonates with me here. What would be a person's, and I know that this is an impossible question to answer, but what would your recommendation be for what's a step that somebody could take to go from here?
Yeah. No matter what they say or what you think, there might be nothing wrong with you. That's the advice. No matter what they say or what you presently think, there might be nothing wrong with you. Once you can come to grips with that you, no kidding, might have nothing wrong with you, even if you're certain that you do, a whole new world opens up. It takes courage. There's some real comfort in knowing that when I step on your toe or when I yell at you or when I take drugs or when I hurt myself or hurt you or say stupid things, that I can actually like blame that on a condition. There's some real comfort in that. I get it. Some real comfort. It's for real. It's great. If I could blame you for all the mistakes I've made just today, that would be good. You can have them. You're the cause of every error I made today. Which I made a handful already. No problem. It's easy to want to do that. It takes courage. It takes a spine. It takes humanity to step into the possibility that no matter what they say or what you think, there might be nothing wrong with you. Even if you feel totally stuck, it is possible that if you could be heard and you could communicate with another and you could follow a few of these easy exercises and practices, tips and tricks, as I've just recently listed, that you could find yourself to a new sense of power, a new sense of freedom, a new sense of purpose, a new sense of humanity, a new sense of worthwhileness that you had forgotten was ever there. The same dude who woke up in that facility, packed with pepper spray, on a gurney or off a gurney without any clothes, who's just looking for someone to care, gets to respond to somebody who does a simple act of giving you a tube of toothpaste, or another who knew that a cop could actually put a washcloth on someone they pepper sprayed. Like really getting that done. What's the importance of caring and listening to another? It is magical. And each and every one of us underneath it all knows that.
Dr. Fred, this has been amazing. We're going to put all the details to your website, all over the links and everything like that, so people will be able to find you. You have been incredibly generous with your time today. And, mate, honestly, just thank you from the bottom of my heart. Thank you so much for today.
Pleasure. For somebody who was pretty sure he was coming at me as a devil's advocate, you didn't do a very good job of maintaining that particular role. And I love you for that. And I appreciate anything you would bring my way. As you can hear, it's the same answer for all of it. It's the same answer. I get to be this guy. It's the same dude. And it's you too. I'm only being that part of you. And that's why you can love this.
All right, mate. You have a great day. Thank you so much.
All right, Mark. Pleasure. Thanks for being here. Thanks for having me.
Thank you for listening to Mark My Words. I'd like to thank my producer, Meredith Brosnan, and also Torian, Kevin, and Lorraine. And I can't forget the band Adelaide, who allows us to use their song as our theme.